No, I actually think that the economy is well poised to be able to see a significant increase in performance, provided that all the steps we identified last year are actually taken punctually and comprehensively, that the implementation we've talked about, you and I, before, is put into place. We're on level 2 restrictions. It's not really stopping us from operating the economy at full levels of activity, although there are clearly some sectors such as tourism and hospitality that have been very badly affected and continue so to be.
Right. Mounting concern around the supply of vaccines in our country as we march towards those targets. Do you think that is rightly government's biggest headache at the moment?
I think it's the country's biggest headache, and it's not unique to South Africa, of course.
Right.
Currently, we're reliant entirely on Pfizer because the FDA in the United States has suspended the ability for us to distribute the Johnson & Johnson vaccine that has already been manufactured by Aspen Pharmacare in Gobera. There's 2 million doses waiting to be distributed, so we're reliant upon Pfizer. But we're ramping up, I think, effectively and quickly across the country, not as quickly as we need to, I agree. I think it's a source of considerable frustration for many people, but we're bringing sites on stream, both in the public and the private sector. By the end of last week, we were on 400 sites with the capacity to administer 150,000 vaccines a day, but because of the constraints you talk about, only actually administering about 75,000 a day, although that's a very significant increase over the past 3 weeks since we launched phase 2.
Ironic, isn't it, that, if nothing changes dramatically in the coming days, you may very well have sites that can operate sitting there doing nothing.
Yeah, that's exactly right. In fact, we are controlling the speed at which we bring those sites online across both the public and the private sector. In the private sector, everything from clinics and pharmacies through, of course, to doctors' rooms, private hospitals, and then the occupational health and safety sites. We've already started those in many sectors of the economy, many more in the queue. But as you say, unless we can bring significantly greater doses of vaccine, we live in a vaccine-constrained environment, not just in South Africa, but globally. We're not going to be able to vaccinate as many people as we need to. And the other point that I would make is that we need to increase significantly the level of registrations. We're targeting, as you know, the over 60s. They're the most vulnerable group, particularly in the context of the third wave that's upon us and winter that is approaching. And only 40% of those have registered. So we must do everything in our power to encourage and assist those over 60 to register and get vaccinated as soon as scheduled.
We'll speak about the EVDS in just a moment. I just want to stay with the supply constraint for a bit longer. In the midst of this bottleneck, what other ways can the private sector help government, if any?
No, I think that what we must do is be as efficient as possible, ensure that we put at the disposal of the country at large. And when you say the private sector, we're also vaccinating those that are uninsured, those that are walk-ins, particularly those that are over 80, using occupational health and safety sites, not just for employees, but for families of employees and the communities within which those operations are located. We need to do so on a fully coordinated and integrated basis if we're going to maximize the rollout as quickly and as comprehensively as possible. I think that's the best assistance the private sector can bring. What we're not going to be able to do is persuade the manufacturers to deliver more quickly than the government is already seeking to do. We've entered into the contracts for enough vaccines for the adult population of the country, but as we can see globally, there are constraints on accessing the vaccine.
Right. And from that, I guess, there might be credence to criticism to government for not having a more diverse candidates of vaccines at our disposal, because if one of the more critical vaccines hits a snag, as has been the case with Johnson & Johnson, we find ourselves facing the kind of problem we are. Is that a fair criticism?
Well, I think that it's an observation. I mean, there's no doubt that Johnson & Johnson doesn't just affect South Africa. It affects, many tens of countries, not just in Africa, but around the world. I mean, there's 100 million vaccines that have been affected by the suspension at the moment. We did, of course, try with AstraZeneca. We need to remember that it turned out that its level of efficacy against the variant that had emerged was much lower than was anticipated. And indeed, the Aspen Institute in India stopped delivering the vaccine that we had already contracted for.
The Serum
so I
Institute,
think that we're in the Serum Institute, I apologize. So I think that we're in a sort of a difficult situation, but not one really of our making. The Chinese vaccine and indeed the Russian vaccines are both going through, as you know, testing here in South Africa. But we need to be very cautious that we go through a due and rigorous process in whatever it is that we're going to administer to the population at large. We know what happened when there was a previous suspension because of blood clots. So people are necessarily very cautious, as I said, and wary. I'm confident, by the way, that not only will we ramp up the level of Pfizer deliveries, they're already ramping up to 645,000 doses a week, and by the end of this month to 1 million, but I'm cautiously optimistic. I think today we might even hear as early as today from the FDA that in the relatively short term, the restrictions will be lifted on J&J, which will massively increase and open up the amount of vaccines we can administer. But as I said, then the next constraint will be making sure that our population is properly registered so that they can be scheduled suitably by the system.
Right. Interesting you mentioned the Russian vaccine. That's the Sputnik 5. The City Press reporting yesterday that it appears we might end up having to pay about 680 million rand, I think was the figure, for about 5 million doses of this vaccine in a context where we'd actually refused an offer of 15 million of these doses for free. Part of what that article mentioned is geopolitical considerations and tensions as a result of that. How worried are you that those side shows are actually interfering with our procurement processes?
Yeah, and I actually think that those side shows, as you characterize it, are a complete distraction, and they're not and shouldn't be the main focus of our attention. The reality is that unless any vaccine has been properly tested, it's been authorized by the necessary the necessary regulatory authorities, including, of course, particularly SAHPRA here, we're not going to use it. It doesn't matter whether it's been donated or otherwise. It needs to be able to withstand scrutiny and go through the necessary testing. There's no doubt, and we've clarified this with government as business, that the necessary funding will be found for the vaccine from wheresoever it is sourced. We obviously need to do so on the best commercial terms and conditions, but a vaccine that is safe and capable of sort of universal administration in the country.
Right. Let's speak then about the EVDS. That's the electronic vaccination data system. You've mentioned our need to ramp up the amount of people registering on the system. It appears, though, anecdotally speaking, that there are people actually struggling to do exactly that. Have we conceptualized what an alternative, if one exists, will look like, given the function of the system?
Well, actually, I think we've been very flexible. We were bound to find teething problems in any system as comprehensive, complex, and universal as the vaccine rollout system. EVDS, I think, has had teething problems which were to be expected. They're being addressed, as the Department of Health has said regularly over the past few days. But by the same token, a number of both public and private sector sites are taking unregistered walk-ins where people register on site and then either return home or are vaccinated there and then in situ. If you look at what has happened in KZN, there's been a very significant number of people who've been registered and then vaccinated on site. So I think that we need to be adaptable and flexible in these current circumstances to be able to accommodate circumstances as they move forward. My own, again, assessment is that EVDS is stabilizing and will be able to perform the functionality that is required, particularly that of registration. I have to say, personally, I was registered on EVDS. I had absolutely no problem in getting vaccinated. Many other people I know in the same circumstances, even if they weren't scheduled, that they were able to walk into an unscheduled appointment and get vaccinated. And most people that I am aware of have had anecdotally, but I think empirically as well, satisfactory experiences in terms of not being turned away, but being vaccinated if they qualified by being either a medical, a healthcare worker, or indeed over 60.
Martin Kingston, always great getting your take on these issues. Thanks very much indeed for speaking to us. Martin Kingston is the Vice President for Business for South Africa.